Autoimmune thyroiditis is seemingly an invisible disease, except to those suffering with it. It is so debilitating in many ways. Autoimmune thyroiditis, also known as Hashimoto's thyroiditis or chronic lymphocytic thyroiditis, affects many systems and functions in the body. Initially, the immune system ramps up antibodies and the attack begins on the thyroid gland, eating away at the tissue that is considered to be the master hormone regulator in your body. This disease is very hard to detect among the traditional medical community. Many suffering from this disease will be told they are simply depressed, anxious, or imagining their symptoms. Most doctors in the U.S. are not trained to look at the body as a whole, and therefore do not look at the underlying symptoms or run labs that are directly related to an autoimmune attack on this vital gland. Some of the most common physical symptoms of this disease include extreme and chronic fatigue, brain fog, itchy, dry skin, unexplained weight gain, cold hands and feet, hair loss, and brittle nails. Emotional symptoms include anxiety, depression, feelings of sadness, and panic attacks. The problem with the misdiagnosis of this disease is that when left untreated, the thyroid gland will eventually become completely destroyed and other more dangerous symptoms and illnesses will occur within the body and mind. Doctor and patient awareness of this disease is the number one way in which the community can help those suffering with autoimmune thyroiditis. Doctors should be knowledgeable and informed about this ever-growing field of functional medicine, treating the body as a whole and the occurrence and severity of autoimmune diseases like Hashimoto's thyroiditis. Hashimoto's disease is the most common cause of hypothyroidism in the United States and affects about 5 people out of 100. Know the facts. This disease greatly affects women more than men. It can occur at any age and it runs in families. Your risk of getting autoimmune thyroiditis is higher if you already have another autoimmune disease like type 1 diabetes, celiac disease, rheumatoid arthritis, or lupus. Last but not least, support your friends and family by listening. If they seem off from their typical self, ask questions that will help you help them, because it truly does take a village.